Hello, everyone, and welcome back to the Living Well with MS webinar series 6. We're so pleased to be bringing you today's session with Jody Barber, physiotherapist, yoga teacher, and co-chair of Therapists Interested in Multiple Sclerosis. My name is Vickie Hadge, and I'm an OMSer and trainee program facilitator living with MS, and I'm joining you today from Connecticut in the United States. In a moment, we'll be welcoming Jody and my co-host for today's webinar, Gina Beach, to the virtual stage. But before I do, I just want to run through a little bit of housekeeping to help keep the webinar running smoothly as possible for you and for everyone here. So first, hello to everybody who's watching on the replay in the future. If you are joining us live, please note that the session is being recorded and you'll receive a link to access the recording within the next week. As this is a Zoom webinar, you'll notice that there isn't an audio or video component for live participants. However, we do want this to be an interactive session, and you'll be able to ask questions using the Q&A tab at the bottom of your screen. We'll start with the pre-submitted questions, but if you've not already submitted your question, please feel free to add them to the Q&A. Please do remember to keep your questions as generic as possible, so we can all benefit from the answers. Jody is not able to comment on individual circumstances or diagnoses. We'll try our best to answer as many questions as we can in the next 90 minutes, but sometimes it's not always possible. If you do experience any technical problems during the webinar, please try exiting your browser and then re-entering using the link from your email. We do recommend using a Chrome browser to access the webinar when possible. If you've tried to make the webinar session, we've tried to make the webinar session as accessible as possible. And today we're using subtitles, which you may see at the bottom of your screen. You can turn these on and off using the CC Live Transcript option. As you exit the webinar today, there'll be a short survey that pops up automatically. And a lot of people may not even realize it's a survey and then they X out of it. But if you can, please try not to do that. It's very helpful for us to receive your feedback. So if you have a moment, please fill it in. Please remember that Gina and myself are not medical experts, and you'll have to forgive us if we struggle with the pronunciation of any of the technical or medical terms. Trust us, we're doing our best. And now, without further ado, I welcome Jody and Gina to the virtual stage. Welcome.
Hi, Vickie.
Hi,
Jody.
I think we're going to start with Gina.
Great. Nice to see everybody. Wonderful to be here. And I guess we'll get started. So, Jody, can you start out by explaining to us what is lymphedema, and is there a best way to manage it in regards to MS?
So lymphedema, it's where our lymphatic system is where swelling develops in the body because our lymphatic system isn't working properly for us. And it causes a buildup of fluid that's called lymph in the body's tissues, and that shouldn't be sitting there. It should normally be part of the blood circulation and things like that. But the lymphatic system works to drain that away. So that's when lymphedema kind of happens in a very simple term. And I used to see that quite commonly in people, particularly legs in people with MS. We see it less so, but I'm sure this question's been asked because there's an individual who's experiencing it. But it can happen anywhere in the body, not just the legs. It can happen in the arms and the legs, the head or the neck. And it's a symptom that's often seen quite commonly as a result of cancer symptoms and some of the treatments, but not a common symptom from some of the treatments that you see with multiple sclerosis. I just wanted to make that clear because there are chemotherapy-based drugs that are used for DMTs and for cancer, and they are different. The most important thing, if you're concerned that you have lymphedema, then it is consult with your doctor first, just to get that differential diagnosis, because not all swelling is lymphedema. So I think that's the first thing really to get out of the way there. But the most common things that you will experience with lymphedema will be swelling. Your clothes might feel tighter in different parts of your body. And certainly if you notice there's a sudden change in swelling, I would always get that investigated. Your limbs might feel different. They might feel heavier or stiffer, particularly if the lymphedema is quite problematic there. But your skin might in that area might feel tight, it might feel stretched, it might feel thicker, and sometimes it can feel a little bit rough or scaly. And then the later stages of lymphedema, it can be quite hardened and more fatty, and then you can get more complex skin problems if you've got established lymphedema. But there are a couple of other things to be aware of as we're talking about lymphedema. Sudden swelling in the calf muscle, for instance, with deep pain could be a blood clot. And they can happen, and they're usually very easily remedied if you seek support from a medical professional early on. But just I think is that going back to that first point is not assuming that all swelling is down to lymphedema. Now, was the question around what is it and then what I can do with it? Because it's quite a long question. Is the best way to manage it was the question.
Yeah, with regards to MS. So it's very interesting to
Yeah.
hear you say that this is not a common symptom of MS and that maybe other swelling that isn't lymphedema could be at play as well. So maybe a more general, if we're experiencing swelling, because I know I can get swollen feet as well, what are some tips for managing that for the MS population at large?
And just because if there's anyone there who has got a diagnosis of lymphedema, we used to see a lot of that with people who were less mobile, less active. But I always would have that question, you know, to have that swelling checked out, particularly if it's new. So in terms of how to manage any swelling or lymphedema, the best way is exercise. But there are some other things that you can do as well, because I appreciate exercising with swelling can be really difficult. So support stockings can also be really helpful. And I was just talking to Jake beforehand. I've got some links of where there's some useful advice where you can go and look in a bit more detail. And some of the best advice is found on the cancer websites because it's a really common symptom in cancer patients. But you can get support stockings. Now, the best way to get the support stockings will be through a medical professional. So in your GP surgery in the UK, you might have a practice nurse who can measure and prescribe a support stocking for you. And there are also lymphedema experts and specialists. And I will include with that the link to the British Lymphology Society and the Lymphedema Support Network. They're not, I wouldn't say they're few and far between, but they're quite hard services to access, but there are also a range of registered lymphedema experts that people can access privately as well if they're finding it hard on the NHS. I was fortunate to work with a lymphedema specialist nurse at the charity that I work at, and they were able to prescribe specialist stockings for people, which can be hugely helpful in helping to manage that lymphedema. The one thing I would say about stockings are that they are a trouble to get on. So I'm thinking about the response to someone who might ask the question. So that does need to be considered, but it's worth looking at in your support system. Is there someone that can help you with putting those on and off? But there are also a lymphedema expert. There are devices that you can use to help put the support stockings on as well and get training to make it easier as well. So I've giving those links to Jake, who can share with the recording afterwards about where you might find who those specialists are in the UK.
Wow, that is so helpful. And I realize that you have such a breadth of knowledge about lots of different topics. So hearing that you've also, worked in especially with lymphedema, can you just briefly go over your areas of expertise and maybe where your interest in MS came from?
My personal areas of expertise.
Yeah.
Yeah, but it's not related to lymphedema or
No, no, because that's no, not related to lymphedema,
yeah.
just
Oh,
MS in
so
particular, and then any other areas that you
yeah.
specialize.
And I can give you some tips on yoga and lymphedema because there's quite a lot there. So my personal journey as a healthcare professional with MS has been over 35 years. When I was reflecting this, it's been yeah, it's quite poignant because 35 years ago, it seemed to be that people with MS weren't given much hope, weren't given much kind of really attention in the field of rehabilitation, and I was curious about, well, why are we told we telling these people we can't do anything to help them? You can always help somebody. So I was very fortunate with that curiosity was around, how you might help someone. And it was just, there was a lot of, yeah, I'm giving you a very long-winded journey, but there was a lot of query about whether exercise is damaging, if it's helpful, and a lot of unknowns. And this is with MS and with neuromuscular disease, my other area of interest and expertise. And so we were a bit cautious, or therapists were cautious about doing too much because you might make their fatigue worse or something like that. So I was fortunate to work at a specialist hospital in London, the National, around the advent of the first beta interferon double-blind randomized controlled trials. So it was very, very, very exciting to be around at that time. And at the same time when other things like chili peppers for managing the bladder and spastic bladder, and also intrathecal baclofen. So all of these other things to support disease modifying therapies and also symptoms were kind of emerging. And with that came like this sense of hope and more therapists realizing that you can help rehabilitate someone and stuff like that. So over 35 years, I worked in a specialist centre, and then I worked in a community team while I brought my family up for 23 years. And with that, I was really privileged and still see some of those clients. My family's literally grew up with people from point of diagnosis to, in some cases, the more advanced stages of disease. So I feel like I've had a real lived experience as a therapist of supporting people, but also education. I've been hugely supported by the MS Trust. There's a lot of support for therapists and educating, and that's really evolved over those 35 years. There was very little understanding. So and now I'm part of, it's quite funny, I'll teach on courses about how to become an expert in MS to newer therapists, and I wasn't privileged to those courses. We were gathering that evidence as we went along. But we were there as the new therapies and things were emerging, and learning, what's the best exercise for fatigue? What's the best? And all of these questions have been and still being asked. So I've been, so it's been a really interesting career, and I've met and watched people thrive, and people, survive well and live well to their later stages of disease as well. So it's very, 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 very varied. I don't know if that's
Yeah,
yeah.
and I do think, this is not a condition anyone wants to be diagnosed with, but I feel very fortunate that I was diagnosed recently, and we do now know that exercise is crucial and is a disease-modifying activity, and we do know that there are things we can do for ourselves to live well and stave off symptoms. Is muscle tiredness over time a common MS symptom in your experience? And if so, can physical therapy and exercise help? This person says sometimes it helps, but then it worsens again. What's your take on that?
Okay, so the thing about MS is that as you know, it can affect anywhere in the nervous system, but it often will affect if there's damage to the myelin, and even if that's repaired a little bit, and your symptoms you may have had numbness or a bit of weakness, and that may have repaired or whatever. The myelin sheath, as you know, is responsible for that fast conduction of nerves, and it's often those long nerves down into the legs that kind of where people notice it. And it is one of those, someone's asked a question about invisible symptoms, that people say, oh, you're walking all right, you're okay, but you know that things are feeling heavier and more tired. So there's those symptoms related to the changes in the nerve conduction. And when we go to kind of reach and do something with our hands, we rely on summation. We rely on all of the nerves coming down at once to be there for us, and then selecting who needs to stay there and who doesn't. And it's those long nerves conduction, that sustainability, that I think the early signs that people see and they don't know, you even don't know yourself. People have said to me, is that really happening? Was my mind, what's going on? That kind of fatigue. So is that fatigue because of the reduction in the speed of nerve conduction you can and that's like a direct MS symptom. And then there's the fatigue you will get from and that might be what that person's asking about. And that's the biggest that's the biggest kind of symptom that most people will talk about, that kind of slowing. I know, you know, my muscles work, but they just don't feel like they're firing on all cylinders like they used to. But it's really, really important to find a way to exercise around that, because what I see as a therapist, and what I see less so as the therapist, I see people much earlier on, is the muscle atrophy, because it's been harder to exercise with that fatigue coming on, and knowing how to adapt your exercise with that fatigue, and knowing, is the fatigue due, is it something that I can manage, is it heat that's affecting that, is it, am I doing too much, am I doing the right type of exercise? And while I can't give specifics, that sometimes I find really helpful. I'll say to someone, just diarize, what were you doing before, what were you doing after, so you can understand a little bit how your own body is responding to exercise. And also comes down to individual choice. Some occupational therapists, etc., with it's around, we'll talk about fatigue management, but some people would say, well, I would rather go out and do that Pilates class with my mates, have a cup of tea afterwards, and then rest the next day because I really enjoy that. And other people, it might be more small chunks of small amounts of exercise. Whichever way you choose that works with you, it's about finding ways to exercise around the fatigue and the muscle ache. But you can also get muscle ache due to delayed onset muscle soreness from exercising a muscle that hasn't exercised for a while. And all of us in the general population can experience that. So, you know, not all muscle aches are related directly to the MS. And sometimes we can't, honestly, we can't answer. It's just holding all of those things that could be responsible in one basket, and finding ways around that. Have I exercised too much? Has it made me too fatigued? Has it made me too sore? That would be normal soreness in terms of if I was exercising without MS, or is this MS related fatigue? So it's never a finite answer, but it's holding those questions. And I think diarising, having a discussion with yourself, having a discussion with a healthcare professional if you've got access one, to try and flesh out what's going on, and finding ways to exercise within all of that, if you know what I mean. I know I think there are other questions about exercise, so I'll stop there.
Yeah, so our next question, besides physical exercise and physical therapy, which we know are, really helpful for fatigue, do you have any other suggestions for maybe complementary medicine or other techniques people could use to deal with leg fatigue and stiffness? And would that differ if someone has relapsing forms of MS compared to progressive forms of MS?
So not exercise, or not physical, or you mean they mean not physical therapy?
That's what they've asked. Yeah. So there
Yeah.
are additional therapies that you might recommend or techniques we could use at home.
If you've got kind of aches and pains, like we've got a lot of free nerve endings in our skin, and if you've not moved your skin, your body much, our connective tissue is continuous from our skin all the way through to our bone, all the way through our bones, all the way through our muscles, all the way through our organs. So sometimes you can feel soreness from moving something that hasn't moved for a while, or it could be sensory changes due to the MS. So if it's that kind of that pain, that discomfort that's preventing you from wanting to move, I would say some complementary therapies that might be worth exploring, and I can't say definitively, might be massage, might be, you know, those touch therapies, myofascial release type massage, and or acupuncture, to have a look at, because they work on the connective tissue as well. So acupuncture has a higher evidence base for support with pain relief. If it's the pain and the soreness and the discomfort, but you're going, yeah, but I still exercise, but it's still uncomfortable. The other thing, though I'm not meant to answer about exercise, is more a movement therapy, like exercising in water, where you've got the analgesic properties of the water that might help make it easier to move. You've also, well, first question started with lymphedema. If you're in water, you've got the hydrostatic pressure of the water. Walking in water is really good for helping with circulation and helping with the swelling as well. The hydrostatic pressure, because the deeper the water, can help with that. So moving in water, I'm trying not to use the word exercise, but also any dance, uh, stretch, yoga, anything, movement for joy, as opposed to like I've got to do it because I have to. I would say move away. So I'd move more into what activities can you do. So, that could be seated dance, could be, there's lots of contemporary dance, something that helps you move in a body in your body that doesn't feel that it's combative. Does that make sense?
Yeah, that's really lovely.
Yeah.
And that idea that all movement, it counts towards, this quota, that we don't have to just like grind it out and do like, reps of specific exercise to still get the benefits of movement. I love the tip about exercising in water. It also prevents overheating, so you can usually move for longer because you're not getting fatigue from the heat. So that's great. Thank you so much, Jody. Our next three questions, I'm going to turn over to Vickie.
Hi,
Thanks,
Vickie.
Gina. Thanks so much. The next question that we have submitted was, could you please ask about the best physio exercises for rebuilding core strength?
Yeah, I've been asked that question so many times over the years as a physiotherapist, but thank you for asking it, because it's a question we get asked a lot. So I think that will be so firstly, I want to qualify what core is. So just so that we're all starting from the same place, and what I believe the core is. So if we're talking about Joseph Pilates and who defined the core muscles, they were talking about a group of muscles in your spine called multifidus that connect your individual vertebrae together. Your abdominal muscles, in particular, one that wraps around your belly called transversus, and your pelvic floor. And that's what they were talking about, that those core muscles, they're very, very deep muscles, and they are responsible for supporting your spine and the heavy bits of your spine. Your vertebrae at the bottom are really, really thick. And through immobility, and lack of movement, lack of innovation, they can sometimes not come online when you need them the most. And you need them the most if you're doing any gravity against any exercise against gravity. But say I'm going to reach forwards and pick something up, I would ideally want them to come online. But they come online kind of first, they're deep, and then other muscles around your torso will also be involved and come on. And if they're not coming online, when you go to pick something up or do something, your arms are taking a lot more, and you've got this kind of, you can't really see what, I'm a physio, you've got this saggy spine and not taking on. So that's what we mean by our core muscles. So when it comes to what's the best exercise, it's firstly, so Pilates and some yoga and some physiotherapists will focus on my early training as a physiotherapist. This book was called Right in the Middle. It was about recognizing, unless you sort out the spine and the alignment of the spine, then it's going to be harder to bring on those those muscles of background postural control, is what I prefer to call them, as opposed to the core, because it's more than just the core. But that's what in terms of the textbooks we mean by the core, those three main muscles, and then the others, the deep muscles. And they can be harder to feel as well because they're so deep. So the best exercise is firstly someone, or finding something that's going to help you engage with deep with your spine, and in terms of alignment, so that's stretch and length, because if you're all bent up, you can squeeze all you want, but you're not going to bring them online when you want. And look at functional movement as well. So Pilates, yoga, physical instructors, all of those will have an understanding of core exercises, what those muscles are. And it's not about gripping and holding them really, really tight. It's about learning to feel them. So a lot of reformer, I work with the Pilates instructor that does a lot of reformer Pilates, because you can use the resistance of the equipment, particularly if you've got sensory changes and sensory loss and it's hard to feel, to engage. And once you can feel them, and we're just working with a guy today who's done that, he can now walk on the stairs without holding on because he's felt them. And then you put that into real life movement practice and without thinking about it. Does that make sense? So
It makes perfect
it's
sense.
not
I love that you say the reformer and the Pilates, using those long engagements and yoga. That leads us right into our next question. Are there any yoga apps or YouTube programs that you would suggest for people with MS?
okay. I was not looking forward to this question because I literally did not have the chance to research YouTube apps and that to say definitively this is the best one, and I'm loath to say. So what I would say, I practice yoga, and part of my yoga teacher training was I had to go to lots of different classes and understand. So there's two things. Yoga is, in its essence, looking at the relationship your body has to gravity and breath. And I would say where yoga is different to Pilates is that it will start with that relationship deeply, and it's also is a moving form of meditation. So I have got some links which give links to a couple of UK charities that have some really good online classes. The MS Society also has some really good pre-recorded clips of yoga on there so that anyone can access. And then the MS UK's got some live classes, some really good live classes. And I know a couple of people on here do access those. And Qigong, we were talking about that with someone this morning at the centre. Qigong they do as well.
Excellent.
So, but I would say if you're looking, we know these people have a good understanding of MS and know how to adapt them. Other local centres also do. Our local centre does online classes as well, in the UK local MS centres.
Awesome.
Well, but yeah, I loath to give apps, but if you're looking for that, just try one out. For me, if I like the sound of their voice, that's the big one. Be afraid. I think variety is the spice of life. So don't be afraid to try different things out and choose. But if you want something that understands MS and can adapt, then go to the MS kind of
And we
charity.
also do have some yoga on the Overcoming MS Hub that you can find if you search for yoga on our hub. And also, our very own Gina Beach does do yoga, and she has her own YouTube channel. So you can check out
Yeah.
Gina.
So
And
go to why have you asked me when you got Gina?
so there are lots of good resources
Yeah.
out there. There are several members of the Overcoming MS community that do yoga, and you can find those on the hub. So that's another good resource. Our next question: how can people with MS maintain mobility and independence as symptoms progress?
Okay, so this is one of my areas, I suppose, of passions really as a therapist is how can you still exercise when there's progression? And I think that can be a hard one for you to accept if things have been going along well. I was just talking to someone today that it can feel like when things have been quite stable and then something changes, that can be, you must feel like you've got to pick yourself up again, and what do I do, or adapt what you're doing. So I would say if you can find a therapist to consult with if you're struggling to know how to adapt, I would do that. But let me start with, say um say you've not say your exercise was walking and you can no longer go out for a walk or walk with, for me exercise is really about companionship. I always do exercise with the body unless I swim on my own. But the if you can't do what you were doing, and that's frustrating. So a lot of people will come to me say, well, I can't run like I used to, I can't swim like I used to, or whatever it is. And and same thing I would say to a musician, let's explore something else that you can do. What are your goals around exercising? Do you like more competitive sport, or do you just like moving? So work out what makes you tick, and always do what you enjoy. So if you like more competitive, then is there something like we play bocce at the centre where I work at, or can you throw things really hard with one of your upper limbs or both of your upper limbs to get your heart rate up, to exercise your upper body. So it's about how you adapt, but working out what you like. Do you like it to be competitive? Do you like it to be more about movement? Do you want to go to a class? Do you there isn't one definitive thing, but I think the hardest thing about sustaining exercise in the context of progression. And so exercise needs to include an element of something that can get you out of breath, which is hard. So upper body exercises, resistance. So I've got one man that I treat regularly who he's just got the use of one arm and he's dependent on a hoist, but we can get him quite out of breath by pulling a bit of TheraBand that's attached, resistance band attached to his wheelchair, and has been building that up. What's been interesting, going back to the first exercise question before about core, he's built up a bit more abdominal and trunk strength, and his bowel movements are better. So you never underestimate the power of exercise. If you've only got the use of one limb, for example, that you can use, you can move his head as well. And so that don't, because sometimes people can think, well, what's the point? Because I can't do this and I can't do that. How can that? But you can see improvements. So there's strength exercise, there's mobility exercise, which is harder. Sometimes you might need to recruit the help of someone to help you move the bits you can't move yourself, but that you can be creative. One of the, going back to strength exercise, arm wrestling is good fun if you've only got the use of one arm. It's being creative about how you can change your position regularly through the day to get a change in position to stretch muscles, or use family members or carer support members to be educated by people on how you can stretch and move. There are amazing yoga teachers out there who are prepared to help and get in and adapt. The yoga teachers are really good at adapting, even if they don't know much about your condition. Yeah,
That's
going back.
wonderful.
Yeah, I
I
mean,
love that
it's
you
quite
suggest
broad
finding
because
alternate ways to get that same feeling. We may not be able
yeah,
to do the same kind of movement that we did before, but we can find another kind of movement that will give us that same feeling and that same sense of satisfaction. So
uh,
that's wonderful. All
yeah.
right, I'm going to turn it back over to Gina for the next bit of questions.
Great. Thank you. Thanks, Vickie. Thanks, Jody. So next from me, what if someone is experiencing pain and they are interested in seeing a physio, but they're concerned that maybe their pain will get worse with the exercise? So I think this is a two-part question. Can physio help with pain? And any tips for someone who might be a little bit anxious to come see you for fear that they're gonna feel really sore or that their pain's gonna be exacerbated?
I think the first thing is to pain's one of the first modules that I learned at university. Pain is when most people will kind of stop moving and seek help. So don't your physiotherapist or therapist who you see will have a good understanding of pain. So don't be afraid to communicate those fears and those concerns to your therapist straight off. They will be receptive and they will understand. And sometimes, so if there's a part of your body that's really painful, say it's your right shoulder. And I was doing this just the other day with someone, but we'll talk about the left hip actually, but you can see my shoulders, so it's easier. So because there's an interesting fact about the anatomy. So I do digress, but if there is a body part that you're really worried about moving, and you're worried that you might need to build that relationship up with your therapist first. So don't be afraid to say, look, I don't want you to touch this because it really hurts, or I'm worried that if I exercise, it's going to be. So maybe don't go straight in for the jugular, as I say. Go in through a route that you feel more comfortable, because if you're anxious, your pain responses will be heightened. It might be that you start with and sorry, Gina, I didn't know you're a yoga teacher. I didn't do my research, but breathing exercises might be a really good place to start to help some relaxation, because if your pain and anxiety go so close together, but they're like a vicious circle, that if you're anxious, your pain will go up. I suffered for years of really painful periods, dysmenorrhea, and I learned from a young age that if I could use relaxation techniques, I wouldn't experience as much pain. But the thought of the pain building up, I used to get anxious. So that I've got that personal experience of, how bringing your anxiety levels down. So it might be that's where you start. You might not even start with the physio. It might be start if you're really anxious about that. That's at one end of the spectrum. The other thing, practically, that if your shoulder's really painful, you're worried about moving it. Your shoulder, and the same with your pelvis, is connected to the other shoulder loosely through something called your shoulder girdle, your collarbone and your spine and your rib cage. So if you move this bit here, you are encouraging a bit of movement on the other side, and the same with the hip and the leg. Your pelvis is a ring of 3 fused bones, but if you really mobilize, and I was doing just the other day with someone, the unaffected, unpainful hip, you will be getting a bit of movement. It's the part you're really afraid of moving. So the ways that your therapist can nudge into that area to encourage movement. But so there's 2 things. What the practical things you could do yourself is move a bit on the other side of it or near it. And there have been really interesting studies on if you fracture your arm and you really exercise the other one, that arm that doesn't get as weak as if you didn't exercise it. So there's evidence that we're all connected, if you know what I mean. So exercise a bit around it, and then sort of relaxation breathing techniques to help reduce your anxiety. Communicate with your therapist.
That's really interesting. And that's also good to know because I think there's also sometimes a concern that we over-exercise our strong side, and will that be better or worse for us? So it's nice to know that exercising on the strong side can have residual benefits, even on the weak side, if that's not as mobile or experiencing pain.
I would never ever like say don't move, don't exercise. And I think it's just how can you engage the non-strong, as you brought that up, the non-strong size. What can you do to bring that online? Yeah.
Yeah, that's great. Is there any movements or exercises that you've seen exacerbate MS symptoms that we should be cautious of or approach with care?
Um, Grossly, no, I wouldn't
Right.
say that, but in certain individuals may have been advised because that's pertinent to them. So I will give an example where yeah, someone might experience like dizziness if they move their head. That's a hidden kind of visible symptom, vestibular dysfunction. But even within that, avoiding that isn't the way forwards. The only time that you would avoid moving if there was going to be structural damage to your musculoskeletal systems. So like you would exacerbate a disc bulge or something, or
Which would never be related to MS. That would
no,
be a comorbidity, some
yeah,
other
yeah, exactly.
additional musculoskeletal
Um,
issue.
But if
Yeah.
someone's asked you, recommended for you not to move, because sometimes people are living with MS and other comorbidities, but in terms of making your MS worse, yeah, there might be certain conditions. Don't exercise in a hot room if you've got heat sensitive fatigue. That will make you feel worse. Don't, you can, all of us can over exercise if you don't hydrate enough before you exercise. I had to do when I was training as a yoga teacher, we did a yoga diary for all sorts of things about when's the best time for you to do your yoga practice. So there are going to be times a day where you find exercise is going to be a better experience for you. So it might be around working out what is the best time of day for you to exercise. What other things might be impacting on your experience of exercise, like the heat sensitivity I've already brought up, and things like that. Yeah, I think I
Sure. No,
wouldn't
absolutely.
say
And
no exercise unless you've been advised structurally not to in MS.
sure. And maybe taking it in chunks, because I think sometimes we get fatigued or our form
Yeah,
gets poor, or like you said, it's too late in the day. So little bit and often is probably a way to go for a lot of
for a
people.
lot of people, yeah.
Um, if we're having sleep difficulties, which affects loads of people in the general population and even more so in the MS population. What can we do to help manage sleep? Can exercise help this? Do you have other tips to help us stay asleep and maybe get to sleep if that's a struggle for us?
Sleep get asked a lot. If you hadn't had a sleep expert on this webinar, I'd recommend you get one. But I'll give you my insights into sleep because it is a big one. So firstly, what is the sleep difficulty? Is it insomnia? That's difficulty getting to sleep, staying asleep for long periods of time. It might be that you wake up during the night and struggle to go back off to sleep again. There are sleep-related breathing disorders that include chronic snoring, and then you stop breathing and start breathing again. And then you can get periodic limb movement disorders, that sudden jerking or kicking in your sleep. So restless leg syndrome. So that's an overwhelming urge for your legs to sort of move in your sleep. So it's just might be worth defining, is it something? So there are things that can be done to help with sleep related, like snoring, and going to I would recommend, if it's that, then firstly understand, is there a disorder to your sleep, or is it general sleep? You just can't get to sleep. So your GP might be able to help you navigate that. And then if it's sleep related to snoring, then Sleep Study Centre could help look at that and look at if you've got sleep apnea and you need support with that. Restless leg syndrome, there are medications and things that can help. But there are many reasons why your sleep can be disturbed in MS, just due to the symptoms of MS. There's spasms, pain, anxiety, depression, waking up a lot to go to the loo in the night. High levels of daytime fatigue can make it harder for you to sleep at night time. So it might be working out, is there everything you're doing to understand that symptom and maximally manage that symptom? For example, if you're waking up many times in the night and that's a new symptom to go to the loo, is getting help from a continence specialist to understand why that is. Is there anything you can do? But then an interesting fact is it's normal to get up at least once in a night if you're over 50, twice in a night in your 70s, 3 times in a night if you're in your 80s. So anyway, I just find that an interesting fact.
No, that is really interesting, and it's good to know that this plagues many people, especially as we get older. So sorting out what's MS and what isn't. We did have a sleep specialist on the podcast, and she recommended keeping a diary for 3 days. What
Yeah.
did you eat? How did you sleep? When did you get up? How did you feel? And to try to backtrack from that and say, okay, do I need to speak to a specific healthcare provider, or what can I do? For me, I know taking baclofen and using magnesium oil helps with my twitchy
Yeah.
legs at night, massage, and not drinking any caffeine. So, people can try lots of things and see
Well,
what works.
I've got a long list here. So staying as physically active as possible is obviously a challenge for people. But if your day's been I know if my day's been less physically active, I can find it harder to go off to sleep. But allow plenty of wind down time before bedtime. Avoid getting overtired. So if you nod off, if you're nodding off and then you go to sleep, that can make it difficult. So trying to go to sleep before that happens. Daily exposure to sunlight, which is hard in the UK, but we've not today because it's been, but getting out there and enjoying it. You've mentioned caffeine, stimulants, trying to reduce your stress before bedtime. I'm really strict with that. I will not have challenging conversations after 9 p.m. My family know I won't answer my phone unless it's an emergency or for your sleep. That, because if you are doing anything highly cognitive or stressful before bed, I won't even watch stressful TV. And have a good bedtime routine, low light levels before bed. So all of these things, a sleep expert would sell you milky drinks, Ovaltine, stuff like that, to try and help bring in those sleep hormones. No TV in bed, things like that. No
And
iPad,
no phones, right?
no phones.
Yeah.
Temperature control is really important. So I can't remember the exact temperature, but if you Google it, there's the perfect temperature of your room, but it's cooler than you think. And then try not to force your sleep if you wake up. Sometimes if you are having to just get up, have a cup of tea, but say have a cup of tea or whatever, or read a book or something light, and just say, I will go back to sleep again. I will go back to sleep. Try not to fight it. There's a sleep expert that I met at conference a few times, and I asked him what his top tip was, because we talk about avoiding alcohol and things like that. And he was drinking a glass of wine. He said, you got to enjoy life. And he said that if your partner snores, you either get your partner's snoring, and that's disturbing you. You either get your partner's snoring sorted out, or you sleep in a separate room to them if that's possible. But I thought that's practical, that a lot of you don't see in a lot of the sleep books. And the other thing is mattress. He said, if your mattress is poor, get within whatever your budget is, make sure that you've got a good mattress, because the surface that you're sleeping on, if that's not comfortable, that will affect your sleep. So
yeah, absolutely. We're going to spend a third of our life on it. We should invest where we can. Those are really helpful tips. Thank you so much, Jody. I am going to send you back to Vickie for the next batch of questions.
Thanks, Gina. We're going to continue on with our pre-submitted questions, but as a reminder, we can still take some live questions. You can use the Q&A tab at the bottom of your screen to submit your questions, and we'll get to those at the end. My next question from the pre-submitted questions is, I find it really frustrating when people don't see what I'm going through because of my invisible symptoms. Any advice on how to communicate invisible symptoms to family and friends who may not understand?
Thank you. I really like this question, because I think it is a hard one. It's a hard one. So the first thing is, and some of these things won't necessarily resonate with everyone. We're all individuals, and we'll all choose to kind of deal with things differently. But I would say some people I know have managed this by doing something themselves, and they have chosen to wear a t-shirt. So there's a lady who I supported in the gym who would wear a t-shirt saying, I'm an MS warrior. And that helped her manage in that environment, that that other people knew that she was, because she looked like everything was fine, as some of you people who have asked this question. But it was a gentle way of starting that conversation and making other people aware that she had symptoms that people couldn't see. That might not be everyone's choice to do that, but that's something that this worked for this particular individual. But you could explain to somebody how your MS affects you and emphasize that it includes invisible symptoms. And I've included in the resource I'm going to send to Jake around there's a really nice article written by a guy with MS. I always think that articles written by people living with it are far more relevant than people experts are, honestly. They resonate. You can't really know what it's like, honestly. And he talked really candidly. They often talk about the inverted iceberg. So there's a little bit of MS that you can see, and then there's a whole host of things underneath. And there are loads of different resources where it can be interactive, where it's like spasms, where you can click on spasms and it will explain. So if you want, you could explain this and then say there's a resource you could read, and there's loads of different resources that people can read that you could give to a friend or somebody to read. You could highlight to a friend or colleague or family member when your symptoms are playing you up, and being open about your limitations. So I share an office with someone living with MS, and she's really good at that, actually. And we do obviously adapt the room temperature. So we know, she's like, I'm worried it's going to be a hot day, so come here with the air conditioning on first, because it's going to really affect my cognition later on in the day. So that's a really nice way. And obviously but she takes control of that, because we're not living with it, and we might not be thinking, or might not have checked the weather app to check the temperature and things like that. But that's a really nice way that you can take control and make people aware, because lots of people just getting on with their own lives. They're not thinking about your symptoms. Or it might be that you're worried about your fatigue, and you might say, look, can I take the bus into town so I can use my energy for shopping when we get there? Instead of talking about your fatigue, it's how you can do something proactive, but you're making that person aware that you've got something that they don't have to consider. But you could try different ways to explain your symptoms. So instead of talking about talking about muscle stiffness might be easier than talking about spasms. So my muscles feel, like really stiff, and it makes it harder for me to move them or feel them or whatever. So there's that kind of, yeah, avoid hiding your symptoms if you can.
Yeah.
Yeah, so
Those are great tips.
yeah.
I find over the years with my MS, I'm just having to gently remind people that my symptoms do change from day to day. And even though you can't see them, I might be experiencing them. I do want to let everyone know on the webinar that Jody's going to be providing some resources and some links. And when we send out the recording next week, we will include those links in there for you as well. And our next question, what should someone look for when choosing a physiotherapist for MS care?
Okay. So you want to make sure that that therapist, I mean, often people in their diagnosis for MS may have seen a sort of what we call a more sports injury or musculoskeletal therapist along the way. And increasingly, I'm finding people are really resourceful, willing to learn and understand. So I would say that I've met many therapists who have really helped people who aren't neurological experts as well along the way. So don't disregard what a physiotherapist would have to say. But if you want someone that's got expertise in multiple sclerosis, ask the question, what's your area of expertise? Because you've got physiotherapists that may be more generalist, but will have expertise in older people, and they actually will have lots of resources to help people out, and they might be able to in terms of balance and stuff like that. They may be neurological physiotherapists, but they may have specialised in treating people with strokes. Again, they have a lot of transferable skills. If you are able to come across a physiotherapist that has expertise and a special interest in MS, that's great, but not all physiotherapists will have that expertise, but you can educate them. So I would find out, what do they know? What are their areas of expertise? Most physiotherapists will have a good understanding. Our core profession is understanding, learning about locomotion and how the body is effective in locomotion, and movement is and how to support that. Yeah, ideally go for a physiotherapist that has some neurological training and background, and older people, because there will definitely be a lot of understanding about balance and the aging system. While some of you might be aging and living with MS, there'll be a lot of transferable skills. I just want to be realistic, because you might not have access to a neurological expert physiotherapist. And I've met people who have then become an expert because they've been empowered and inspired by treating someone with MS. So you go and grow an expert out there, I could say,
Excellent.
frankly.
Excellent. And I do want to remind everybody that on the hub and on our website, we do have some resources. We've worked with physical therapists as well. One of them is Dr. Gretchen Hawley, and she is a physical therapist and MS specialist. So there are some resources available there as well. Our next question is, what's one piece of advice that you can give to help me take control of my health?
Okay. So this is a question that's been asked to a physiotherapist. And I would say exercise. And I know that's going to be really, really annoying. And the reasons why is, I think the evidence is very, very compelling. And the evidence is around maintaining your brain volume. And in particular, it's exercise. So I don't know who it asked this question. Obviously, I don't know, but if they're newly diagnosed or whatever. But if I was newly diagnosed with MS, and there's a woman called Amy Thompson, who's she's CEO of MS Together, and she's running the Paris Marathon in this weekend. And she's a really good example. Now, someone might say, well, I can't do that. So it might be upper limb exercise, but any exercise that gets you decently out of breath. So HIIT, aerobic exercise, because it's that type of exercise that gets you decently out of breath, and you don't have to do a lot of it, just regular small chunks of it through the day. It doesn't have to be a marathon runner. What that does is the studies have demonstrated that that increases the particular proteins that you need in your brain to maintain your brain volume. And for me, that type of exercise, that type of evidence and emerging evidence is what's emerged over my years as a physiotherapist. As I said at the beginning, there was a debate about, oh, is exercise too much? Should we just be a bit cautious with these people with multiple sclerosis and neuromuscular conditions in case we make them worse? And then some epidemiologists came out and said, you are going to make people are going to get unwell from other comorbidities from not exercising. So forget that, make them exercise, encourage people to exercise. And then we discover exercise is just the best thing that we can do, but it's exercise that gets you out of breath. So I'm sorry I'm a physiotherapist, but that is a one piece of advice I would give, because it has that and give up smoking.
Yeah. Yeah, I completely agree. I read a research paper that was released just a few years ago where they said exercise is the single most effective non-pharmacological treatment for multiple sclerosis. So right after medications, exercise is the second most important thing. Thanks so much. All right, I'm going to turn it back over to Gina for our next group of questions.
Great, thank you, Vickie. Okay, let's see. Ooh, my spreadsheet's going crazy. Hold on a second. Okay. Do you have some go-to exercises to help with nerve pain? And what are they maybe? How can we try them at home and see if they'd help us?
Okay, so nerve pain is yeah, it's difficult, and I don't know the individual. So I would start with some relaxation exercises, some breathing exercises, and movement. I'd say, yeah, I'm a physiotherapist, but movement. I would say I'm an inquirer and a learner and a facilitator of movement. So I can't give anything definitive, but I would say, yeah, nerve pain can be really distracting, and sometimes just deep breathing exercises, relaxation, and movement that's not focused on the area of the body that's painful. So, and I've talked about dance, I've talked about yoga, and things like that might be better than trying to persecute that part of the body with making it move straight away. And we've talked about pain, and I'm assuming if there's sensory or hypersensitivity, it's moving another body part. And as think about more about I'm improving the blood flow to that area, and blood flow is really important for nourishment and nourishing that body part. And particularly, there are things that you can do that will increase blood flow directly through the nerves. So flossing of your sciatic nerve, or flossing, so upper limb exercises where you're moving from side to side like this will just gently floss your median nerve through your arm. And so maybe ask a therapist, or your yoga teacher might even know about what exercises will increase the blood flow specifically through my nerves. That might be helpful. It might not be helpful. It might, but yeah, I would say that will improve the health of your nerve for sure. And I do introduce a lot of what I call nerve mobilizing exercises into a movement class that I might teach, or an individual session, and say this is increasing the blood flow through your peripheral nerves to help with the health, help keep it healthy, because we need to be interested in the health of our nerves, particularly as with MS, some of them might have, a thinning of the outer lining of the nerves from the damage from the myelin.
Yeah, and I love that idea that it's about mindset. We don't need to again be really forceful or aggressive with that part of the body, but all movement is good, and all movement is a holistic, promoting blood flow, promoting circulation. What about spasticity? I know we talked about it a little bit at night when we were talking about the sleep question, but what about daytime spasticity? What can we do to manage it and spasms besides medication?
Okay, so spasticity, often people experience that in their legs, but you can also have that often you'll experience that in your limbs, but often legs, can be arms as well, can be anywhere in the body. But weight-bearing exercises, there have been some very small studies that have evidence around weight-bearing exercises can help. So if you find that difficult to stand, it's finding a device that can help you stand up to help with, if you're wheelchair bound or whatever, weight-bearing exercises can be helpful. But also going back to talking about our core and our background postural control, that if that's not as engaged, you fix a lot more with your limbs, with your legs and your arms. So it won't have an immediate effect, but learning how to engage your core muscles, your trunk muscles through Pilates, through yoga, that type of keeping that strong can help minimize the spasms, the spasticity. Yeah, it will be very, very individualized. There might be something that's got a bit tight, a bit of out of alignment, and you're overusing. And so having someone assess that and see if there's something you can do to specific to bring your joints, because there are places where our bones, when you stand, where you get your bones just to load, so the muscle activity is more efficient. So sometimes we're overusing, and that can exacerbate the spasticity. But the other thing is always to do that kind of health check around how's my bladder functioning and my skin. Have I got any, if you've got sensory loss, have I got any areas, even just the tiniest little tissue tear that you can get from dry, cracked skin can cause something that can exacerbate a bit of spasm, a bit of pain. Sleep as well, I've mentioned before. So it's just checklisting your general well-being and your anxiety, all of that. They're all going to impact on that. So it might just be, am I feeling a bit, overwhelmed, a bit too much? Is life coming at me too much? Is it worthwhile me investing in some deep relaxation, some yoga or yoga nidra or whatever, just to help kind of reset my nervous system? And will that help support my symptom of spasticity? So yeah, I've covered a range of different things that might help.
Yeah, and I really appreciate how you're really integrating the exercise and the stress management pillars of the Overcoming MS program, and how the physical and the mental are so inextricably linked, and we need to pay attention to both. I know you mentioned very briefly vestibular exercises in passing, but can you talk a little bit more about that and any advice you have on improving balance?
Yeah, certainly. So in order for us to balance efficiently and well, we rely on a good visual system, so our eyes. We rely on a good musculoskeletal system, so our muscles, our joints to all work and to have good sensory feedback. We also rely on an organ in our inner ear called the vestibular system. That's separate to the cochlea, which is the hearing system. And it's a very complex organ that detects accelerates, sort of acceleration, movement of your head. And what it does in a nutshell, when I move my head forwards, it allows my eyes to move at the right speed and kind of and steady my environment, if you know what I mean. So when I turn my head, my eyes come round and the world is still, because so, and this is a symptom that I see, like they say, the studies say about 50% of people with MS will experience vestibular dysfunction. I would say it's a lot more in my personal clinical experience at some stage, to lesser or greater degrees. And it's one of those invisible symptoms that can even be invisible to the person living with MS. They know that because what you've done is you've learned, oh, that makes me feel weird, and you've learned not to move your head as much, not realizing you're doing it. So vestibular symptoms are often experienced as a feeling of just straightforward dizzy, a bit nauseous on movement, or like some people say they can feel like they're walking a little bit like they're drunk sometimes, but not always. The symptoms can feel like they can come and go. They might come on in certain situations. They might only come on in sort of busy, crowded situations, because your visual symptoms are your visual system's being challenged a bit more. And the trouble with MS is you could have a little bit of a visual problem, a little bit of a muscle joint problem, and a little bit of a vestibular problem. You put that all together, your balance is going to feel really out of whack, and you can't really explain to anyone why. So I can't recommend enough seeing if you can find somebody with an expertise in vestibular to unpick that all for you. Now, the challenge I find as a physiotherapist is that person, and I had this the other week, you need a good hour to 90 minutes to properly assess the vestibular system. But you as a person need to be fully engaged in wanting to understand that. And if it's not the right time for you and it's not a priority, and I will always ask this because the way to help it is often through doing eye exercises, but you've got to do a lot of them regularly, little chunks through the day. Now that's not always, but that's often what people need to do, because it might be somewhere along the line you've had a bit of inflammation on the nerve that talks to your ear and your eye, and it's got a bit out of whack, and it's a bit like you've broken your arm, you've had it in a cast, you've had it still for a bit, you've taken the cast off, and then no one's told you need to exercise it. With the vestibular system, you may have been dizzy in the past, sat still for a bit, not moved much. Oh, it's got a bit better, but then certain things bring it on. But no one's told you need to exercise it to get yourself back to baseline. And that's often what I find I see with people, but you do need to dedicate quite a bit of time to improve that. There are some people that have put some suggested general vestibular exercises on that people can have a go at, so they're worthwhile. If you can't get access to a vestibular therapist, I can try and add that to the resource.
Yeah, that would be great. So
Yeah.
what percentage of people do you think are having vestibular issues versus something else causing their balance problems?
So for issues specific to vestibular dysfunction, the studies say around 60% of people. I would say most people I see with MS have got it's what's a prevailing symptom that's affecting the balance. And it could be if it's sensory changes in your feet, or visual symptoms. Often there's a little bit of everything going on, but with the vestibular dysfunction, so I haven't really nearly everyone I meet with MS at some stage has had sensory dysfunction in their feet at some stage. It's really common, but that can come and that can go, and obviously that's going to affect how you take steps and move and balance. But the visual symptoms are often the ones that are harder to describe and harder for you to identify, because they come and they go, and you can stop them coming on by not looking up too quickly. But it might be if you've looked up and you felt a bit dizzy or a bit off balance, or a bit, sometimes people say, I feel like I'm rocking on a boat, or someone's taken my head off and put it back on again the wrong way round. So those kind of odd symptoms that you can't really describe might be alluding more to a kind of vestibular dysfunction. But often most people who meet with MS have probably had optic neuritis, or other things going on, but it's what's the prevailing thing that's getting in.
Sure. So it sounds like it could be a combination, and you
Yeah,
try to see potentially multiple specialists to get to the end of that. That's really helpful. And I'm going to turn you back over to Vickie for the last three of our pre-submitted questions before we go into our live questions.
Thank you. Thanks so much. Our next question is submitted. Sometimes I experience numbness, tingling, and weird temperature sensitivity. Do I just have to live with them, or are there ways to manage these symptoms?
Do you know what? I wish I could give an exercise to take away these unusual symptoms, because it's something that yeah, people talk about most commonly, and I can't imagine actually what it's really like to live with those symptoms. And I think often peer-to-peer support is talking to each other and sharing those symptoms. It's validation that your body isn't your body that it used to be. I think that's really helpful. In terms of exercise, I think I will be really candid as a physiotherapist and say, I don't think I can give an exercise to take that away from you. It's accepting that you have altered sensations is one of your symptoms that might be with you forever or for a short period of time. We just don't know. But the most important thing is, how is that impacting your ability to do the things you want to do, to move, to exercise, to function? And what can we do to support you to move in spite of that? How can we manage that? And sometimes it's kind of sensory stimulation exercises might be helpful to engage positively with that body part. So rolling your foot over a spiky ball or something, or as I said, stretching, moving exercises, or if you're really anxious about it, going back to the kind of, as Gina and I discussed, the kind of body, mind, breathing and stuff like that. So I'd love to say, yeah, there's an exercise. Yep, do this exercise and this will take away your altered sensations. But it's one of the hardest things to support people living with. And I was talking to a lady the other day and she said, do you know what, Jody? I can't remember what my feet felt like because I've been living with this for 20 years. These are my feet.
Yeah.
And I think sometimes talking to other people can be really helpful because I watch this when I watch other people. I'm privileged to sit with other people who we have evening sessions called Connect with other people. It's that peer to peer, like, I get that, I get that. And it's that validation, that shared experience is also really, really helpful as well. So I can't give you an exercise, but it's working with accepting that this might not change, but how can I exercise kind of in spite of that as well.
Yeah, I love your advice to do that external stimulation. My therapist has recommended I do that as well. I have a foot machine under my desk that has these little balls that roll, and I rub my foot up and down on these little balls, and that does help me some. And I've also heard um, you can use like a container with uncooked rice and put your hand or your foot in there that's experiencing the tingling and the numbness, and it might help with that a little bit. Excellent tips. Our next question goes back to sleep. Does meditation or breathing exercises help with sleep? This person has been trying to do them every night to wind down, but they're still struggling to sleep and they're feeling even more tired.
Well, meditation and breathing exercises can help. The goal of those are we've got our two main nervous systems for kind of like arousal for fighting lions. So your sympathetic nervous system is there to kind of, mine was on a little bit more before the webinar started, to help with performance, to help with doing things that are a little bit more stressful. And then we're often that's switched on more during the day. And then as we're going to bed, we want the parasympathetic nervous system, that's your rest and digest system, to be more switched on. So the goal of deep breathing exercises and meditation is to try and bring you into a deeper state of rest. But if the exercises that you are trying aren't helping, it might be that you do need to work. I'm assuming because you're exploring this, it's an area that you're interested in, but I would maybe explore something like a yoga nidra workshop or a yoga nidra course, which is the art of deep rest and deep relaxation. And that will take you through a whole series of like somatic experiences where you're invited to pay attention to different parts of your body, all your senses, and then there's a bit of storytelling that allows you to take your body, and they can say it's sometimes like you've had 4 hours of deep rest and deep sleep doing that. So if you're finding, I hear this a lot, I've tried Headspace app, I've tried this and it's just not working, and if it's really annoying you, it probably isn't working. But if you're interested in that area, it might be that you need to like boot camp it, is what I'm trying to say.
That's excellent advice. I recently took a yoga nidra course. I did a yoga weekend and it was really helpful. It was only a 30-minute class of yoga nidra and I felt so rested after. It was really quite amazing.
Yeah, I can't recommend that. Yoga nidra simply is the art of deep rest, deep relaxation. But yeah, I would say 30-minute class is a good one to start, because you can do 2-hour ones as well, but that might be too much to start off with.
Okay, our next question, can exercise and physiotherapy help with brain or cog fog?
Um, yeah, so there have been several studies being done recently looking at the relationship between exercise and cognition. And then the question I usually get asked is what type of exercise? So there've been studies looking at the relationship between walking and cognition. And it doesn't need to be a huge, I can't quote you on the exact amount. It doesn't need to be a huge amount to improve your cognition, but it needs to be regular. So there is a huge relationship between cognition and exercise in all domains. So we're looking at everyone's brain, but also the MS brain as well. But there have been quite a lot of studies, and the conference before last in the UK, the MS Trust, that yeah, cognition and exercise was the running theme there. So but then people say, what type of exercise? And any type of exercise is going to have a positive impact on your cognition.
Wonderful advice. I try to move my body purposefully every day. All right, I'm going to turn it back over to Gina for our next batch of questions.
Great, thanks. All right, so we've got about 15 minutes left, and we have got about 9 questions from the audience. So we'll try to do kind of a speed round, still answering, but moving through them efficiently. Can you start by answering, can you get a flare up from being overactive?
I'm going to politely, I would say that's a question I would ask a neurologist. My personal experience, I would never, I would say no. I would say no, but I would say honestly, there are neurologists might have a different answer to that, because not exercising has going to have more detrimental effects than exercising. So I would say,
Yeah, and what we have on the Overcoming MS website is research that suggests that while individual symptoms may temporarily be exacerbated from exercise, you're not actually causing any neurological damage, you're not enhancing any lesions, you're not making your MS worse, even if you experience a symptom flare during or shortly after exercise. Do you know if Fampridine, Vampira is beneficial for people with MS who have mobility issues? Do you have any experience with clients who use Fampridine to improve their walking?
yeah, so there's Frampidine Clinic held in London at Queen Square, and but they do have a sort of set criteria of who they think it's going to benefit. But I've got quite a few clients who I see who are on Frampidine, and have found that really helpful. But yeah, so if you're interested, it's working out, is there a centre near you that's conducting any of the Frampidine trials?
Great. And I know it only works in about 40% of patients. So I know that for me, I'm going on a trial in June. I'll have the medication for 3 weeks. They'll measure my
Yeah.
gait and my speed of walking at the beginning, and then they'll measure it 3 weeks later. And then if they've seen a statistically significant improvement, I'll be allowed to stay on the medication. But I've been waiting for 2 years to become part of the trial. So if you are interested, talk to your MS team and see if you can get on the wait list, because it can be a little bit of a long time. And then do you have some specific exercises that you suggest to people who experience foot drop?
Um, yeah, so for foot drop, first of all, I would make sure you're maintaining the health of that area. So my light here is not plugged in, so I'm going to plug it in. I'm getting darker and darker. So so looking at sort of I send a YouTube video that I've made of lots of foot exercises that you can do to maintain the kind of movement and range and mobility of your foot. Because sometimes if it's not your foot's designed to be a mobile platform with it's got lots and lots of bones and joints and ligaments in it, and if you're not able to lift it up and move and normally on it, then other things can get stiff. So you want to maintain that mobility of the foot in general. And then exercises that can help with foot drop, there's lots of toe and exercises and feet exercises, scrunching the toe up, rolling the foot over the ball to exercise around that. There are lots of exercises that you could do. Even thinking about lifting your foot up, it will increase the blood flow to the motor association area of your brain. So our brains house different areas where your hand is represented, your foot is represented. So particularly in stroke rehabilitation, there's been loads of studies done about thinking about moving it. Or another thing is mirror therapy. So if you put your foot next to a mirror, the foot that doesn't have foot drop, and the foot that does have foot drop on the other side of the mirror, and you lift it up and you look in the mirror, it tricks your brain into blood flowing into that area of the body. Now, there haven't been extensive studies done on that in MS and foot drop, but they're all motor studies that have done and looking at how you can improve recovery in stroke. So those things, you know, if you really want to, and it might just be that there's not been the drive or the investment or whatever to have a look at it. So
But that's great. Sounds like there's lots we can do
yeah.
and lots of exercises that can strengthen those muscles and help reduce or, potentially improve foot drop. Great. I'm going to send you back to Vickie for the next 3 questions.
All right, continuing
Still
on with
not
the lightning
disappearing into the
round.
dark. I have my lights set up and I'm not turned. Yeah, it won't turn on.
All right, for our next question, what advice would you give to a physiotherapist that's been diagnosed with MS and works in healthcare full time in terms of managing the condition while working and the stress that it brings?
Actually, I've worked with 2 colleagues who've been diagnosed with MS, and they both worked in a specialist neurological centre, and they found it too distressing to work with other people with neurological problems and MS. So moved to working, I don't know where this person's working, moved to working in an area that was not where they wouldn't meet someone else living with MS, because they just felt. Now, another person might feel differently about that, feel they could bring a lot of value to that, but for them, they moved into an area where they could, and I would say if you're a neurophysio, it's quite, I don't know what area they work in. Physio is a physically demanding profession, and as I've got older, I've chosen to balance my hands. In particular, I got early onset arthritis in my hands, so I've had to balance my week so that I'm doing, online sort of therapy and teaching and stuff. So there are many other areas of physiotherapy, like mental health and stuff like that, where it's not as physical, where you can still add value as a physiotherapist. Or if you're worried about your managing your fatigue. I mean, everyone's journey is really different, and I know people who are like running marathons and have MS. So it's not, but I think it depends on that person's individual journey, and do they want to make a decision to move into an area where they're not going to meet other people with that condition, or meet other people with that condition. I think that's a question to ask themselves. I can't answer that for them. And
That's
is
great
fatigue,
advice.
impacting you? So is now a time to work in an area where I'm not relying so much on my physical ability, but there's occupational health departments, there are that can help you with make those reasonable work adjustments as well, so that you can still do the work in the area that you enjoy.
Awesome. Thank you so much for that. The next question, have you read the scientific paper that links working above lactate threshold with poor health outcomes for people with MS due to the greater accumulation of lactic acid in the brain and the spine?
No.
Okay. Are there any exercises that are easy to do at home with no equipment to help build and maintain muscle?
You've got gravity is a really good resistance to exercise. So with no equipment, it's looking at, so the bridge exercise is one that often physiotherapists give, because you don't need any equipment to do that, and you can work your gluteals against gravity. Sit to stand, it's the exercise we do every day. You can work your hips and your glutes against gravity, lifting your arms up above your head, or supporting your body weight on your arms in a plank position and legs in a plank position, depending on who you are. Gravity, all of those things that involves how you move your body in relationship to gravity and hold your body in relationship to gravity. You can definitely get a lot of resistance from that.
Awesome. Thank you so much. All right, back to you, Gina.
All right, we
I
are.
am here. I found another light.
Oh, great. Yeah, go ahead and turn that on so we can see you. It's nice. Lovely. Yeah, that's
There, is that gonna? I didn't think this through. Sorry.
that's all right.
Yeah.
All right, we've just got a couple more questions. So this person says that when they work out, it takes them a few hours to stop shaking due to tremors. What's your recommendation? Is there anything they can do for this?
Oh, that's a hard one. I'm sorry that that person's experiencing that symptom. Sometimes there, because of where some shaking might be, it's understanding, is there a reason for the shaking? Is it because there's the part of the brain that's responsible for controlling the coordination of the body? So the cerebellum, I don't know. But it will be, can you break your exercise up into more chunks? Maybe diarize and go, well, is it related to the type of exercise I'm doing, or is it a core symptom that I have that it's going to happen anyway, whatever I do? And well done for exercising in spite of having that horrible, horrible, horrible symptom. But maybe go, well, if I did, I don't know how long you're exercising for. I heard that you're resting for 2 hours afterwards, but are you doing a 2 hour workout and then resting? I don't know. So is there a relationship between the type of exercise you're doing, the length of exercise you're doing, and how much you're shaking? That might be the first place to start. I would say just
Yeah, that's great.
write a bit of an exercise diary and try different things.
Um, so what's your experience with electrical muscle stimulation for strengthening muscles? If someone wanted to try it, is that a case where they ask their physiotherapist, or do they wait for it to be recommended to them? How does someone see if that might be a good, um, a good
Yeah.
item for them?
So functional electrical stimulation is used, and the evidence-based and research studies for that with foot drop are really, really strong, but you can use it in other areas of the body. And recently treated a gentleman who had, for want of a better word, he had just a real sensory weakness. So his lack of sensation meant he wasn't using his side of the body, and electrical stimulation actually was able to help bring back recovery on that side. That's not always the case, but I'm a real advocate of electrical stimulation. It can also help, so it can help in muscle recovery if you've not been moving that part because of disuse or sensory loss. If you've got motor damage or motor loss there, it can help, particularly with foot drops, through stimulating the nerve, the peroneal nerve at the bottom. It can help provide that action for you. Now, there's a word of warnings for some people. The fatigability of the nerve can mean that the electrical stimulation is not helpful. But if you want to access that, it's probably best through specialist centres, some private providers, but they're incredibly expensive. I would always recommend going to a specialist centre where you could trial using it. And when where I used to work, we used to do an assessment, and that person could trial that for 6 weeks to see if it was going to help. You can use it on different body parts, muscle parts, to help with recovery. It certainly will help with blood flow and muscle health as well. So you've got things called neurostimulators that you can put on that will help, like people used to call them slender tones for like weight loss, but that can help with blood flow and nourishment. So that's really, really, it depends what your goal is, but if it's for improving movement and muscle strength, yes, there is evidence, but it is very individual. But there's usually, you could get complete recovery in some cases, or you could aid some recovery or just replace the muscle action, definitely in a case of foot drop.
But it sounds like it can work for some people, so do find a professional who can help you try it if that's of interest. Yeah.
But I would try and find that on, a healthcare professional where you can have a free trial or a money back guarantee trial, because some of these devices, there's lots out on the market now, and you're looking at £3,000 to £6,000 in this country to purchase privately. And the thing about electrical stimulation, because it's a bit techie, what I found is then the effort of putting it on for some people isn't worth the outcome. And I feel really sad if someone's privately purchased someone and they've not stuck with it. And I'm not saying that's the outcome for a lot of people. It's going to work. Most people say the effort's worth it. But I think trying it out is something that you want to make sure you do before you privately purchase anything, for sure.
So that would be like a new fit or like a sleeve or something like that. Because I have a Fez device that my neurophysio recommended, and I think it was like 30 pounds. I bought it on
Yeah,
Amazon.
no, the
These are
neurostimulation.
different, I guess,
Yeah.
a little bit different devices than the.
Yeah, so I'm talking about the ones that will support foot up,
Yeah.
And there's various different products and companies that do that, but the sort of muscle stimulators, they're like, you could get them really cheaply, yeah, 30 quid, yeah.
And then, so thank you so much, Jody, for your time, for your expertise, for talking through so many different topics with us tonight. We did have a great recommendation from one of the participants today. So Balance Works does group vestibular therapy. They do online classes if you're interested in
Oh,
that. And
amazing.
vestibularspecialist.com/group-classes also has some resources. And so we'll add those to
Yeah,
the resources that Jody sends so that if that's of interest to you, if you are having balance issues, if you want to see if vestibular therapy can help with those, that could be great. So thank you so much, Jody. I'm going to turn it back to Vickie for the close. Thank you, everyone, for showing up and engaging with our webinar.
Thank you so much. And thank you, everybody, for joining us today. A big thank you to Jody for today's session. I hope that everyone has enjoyed the webinar. And just as a reminder, you'll receive a recording via Zoom next week. We'll also include links for the resources that Jody has mentioned. I'd like to thank my co-host, Gina, and also Jake, who's been working feverishly behind the scenes to support with all the background and the tech and the questions. We'll be back with another webinar on May 7th with Overcoming MS program facilitator Heather O'Neill for her expert insights on physical activity. And I'd also like to share that Overcoming MS is running a one-day hybrid lifestyle event called Living Well Live on Saturday, November 15th. And that's going to take place at the Slate at the University of Warwick. So if you're interested in doing an in-person or online, you can do that. You can connect and learn more about that and our lifestyle changes. Follow us on social media accounts and stay tuned for more details for that are going to be released soon. Just as a reminder, as you end the session, you'll see a short survey. It's really important for us to get feedback on these sessions. So please do fill out that survey. And thank you, everybody, and we'll see you soon.